Welcome to our microlearning series, brought to you by Centene Behavioral Health's Clinical Provider Training Team. This module focuses on titrating services. This microlearning is one of 4 in a series. The topics covered in this series are care coordination, treatment planning, titration of services, and discharge planning. Check out each microlearning for more information on the topics listed. By the end of this module, you will be able to define titration of services, identify the importance of titrating services, review best practices for titrating of services, and identify barriers to titrating services. According to the American Psychological Association, titration is a technique used in determining the optimum dose of a drug needed to produce a desired effect in a particular individual. The term titration has historically been used when talking about medications. However, it also applies to other forms of treatment like psychotherapy. Many drugs need to be slowly titrated downward, instead of quitting them cold turkey, to avoid discontinuation side effects, and to monitor for the recurrence of symptoms. Similarly, therapy and other support services should also be reduced slowly to avoid worsening of symptoms and feelings of abandonment by the client. Let's look at some of the reasons why titrating services is so important. Studies on psychotherapy have shown that most improvement occurs during the initial stage of treatment, specifically during the first 6 sessions of outpatient psychotherapy. In later phases of treatment, like sessions 7 through 12 and 13 through 18, the majority of patients show either a small improvement or no change at all. These studies also showed that improvement was greatest in the first 12 months of treatment. Studies like these demonstrate that it is not necessary to be in therapy for years in order to achieve improvement in symptoms. Another reason titration of services is so important is that it helps promote independence. Providers should discuss with clients openly during the start of treatment and throughout the treatment process that a major goal of therapy is to work towards effective independent functioning. This includes helping clients identify their support systems outside of therapy and assisting with coordination of care. For more information on coordination of care, check out the care coordination micro-learning that is a part of the series. Titration of services also helps ensure individualized treatment. The length of treatment for psychological problems will vary from one individual to another. Essentially, the treatment type and duration should always be matched appropriately to the nature and severity of the person's presenting difficulties. Acute difficulties usually require fewer treatment sessions than do chronic conditions. Moreover, length of treatment also varies with the type of treatment provided. How do you know when someone is really benefiting from their treatment as opposed to becoming too dependent on their therapist and staying stuck? Titrating services helps discourage unhealthy attachments to treatment providers because it promotes independence and monitors the client's progress. As clients reach their goals on their treatment plan and show improvements, services are titrated down. Conversely, if symptoms get worse, services can be titrated up to increase frequency and duration of services, as long as documentation supports the medical necessity of that service. Titrating services helps make sure the client isn't stuck in a particular level of care or becomes too dependent on a provider or services. Depending on the severity of the illness being treated, therapy might not necessarily entail frequent regular sessions for the entire course of treatment. Therefore, billing for regular sessions when they are not medically necessary leads to overutilization of services. When providers titrate services, they are being good stewards of limited resources because they are not asking to be reimbursed for services that are not medically necessary. It is an unfortunate truth that mental health resources are limited across the United States, so providers and managed care organizations must work together to prevent overutilization of services. Now let's discuss some best practices we can implement when titrating services. Make sure to conduct a thorough assessment with each client at the beginning of treatment. This includes accurately identifying mental health diagnoses and documenting frequency, duration, and severity of symptoms. This will help determine the appropriate level of care, as well as the frequency and duration of services. Remember, the length of treatment for mental health problems will vary from one individual to another, depending on how severe the presentation of the illness is. Make sure to plan for discharge, starting at the beginning of treatment. Providers must make sure they are not promoting never-ending therapy. This way clients can work on accepting that eventually they will be discharged from treatment. For more information on discharge planning, check out the discharge planning micro-learning that is a part of the series. Throughout the course of treatment, make sure to document improvements and regression. This will help justify the number of units requested. Identify natural supports, such as family, friends, and community groups, so clients are prepared to titrate and are working towards discharge. Avoid submitting blanket requests, like for instance requesting the same number of units for every member, for every authorization. Providers should base the number of units they are requesting on the individualized needs of the client and on the presentation of symptoms associated with the diagnosis. Centene Behavioral Health does recognize that barriers may present for both providers and members in their efforts to titrate services. These barriers may exist from the member, from the environment, and from the provider. For example, the member may resist stopping therapy for fear that symptoms may get worse. Oftentimes, members become accustomed to the routine of seeing their provider on a regular basis and may resist termination because they will miss the comfort and support they receive from their providers. Sometimes, things happening in the client's environment that may also present as a barrier to titration of services. For example, many people are experiencing an increase in symptomology due to stress associated with the COVID-19 pandemic, leading to a greater need for mental health services. Other environmental factors that can lead to an increase in the need for mental health resources include financial problems, death or loss, divorce or separation, medical issues, or any other crisis. Lastly, sometimes providers themselves could be a barrier to titration of services without even knowing it. Feelings of countertransference can lead the provider to want to continue seeing the client, even if the client no longer needs the service. In addition, providers may feel pressure to meet productivity requirements or expected to accrue a certain amount of billable hours. It's important to remember that the provider needs should not come before the needs of the client. Centene Behavioral Health's mission is to help people live their best lives by being the trusted partner to create superior solutions in behavioral health care and wellness. We simply can't meet this mission without our providers, and appreciate the work you do to meet our members' needs. If you are experiencing any barriers to titration of services or have any additional questions, please contact Hope Tomford at the information provided on your screen. Thank you for attending this micro-learning on titration of services. References for this micro-learning are shown here. If you would like to review any of these references, please click the pause button and write down the items of interest. To move on from this video, please click the next button at the bottom of your screen.